Hi there, and welcome to this video. Today I want to talk to you about sort of pelvic pain, SI joint pain, pubic symphysis pain. It's maybe something that you've been told that you have. Hi, Dr. Surinder Sandhu here from Bedford Chiropractic Clinic. With over 25 years experience, I am the most experienced chiropractor in Bedfordshire. Over that time, I've treated well over 30,000 patients and actually completed over 130,000 adjustments on my wonderful patients to help them. So today I want to talk to you in this video about sort of SI joint pain and pubic symphysis pain. Now, SI joint pain is something which is very, very common, especially in women who've had sort of pregnancies, and especially women who've had difficult pregnancies and multiple pregnancies. In particular, the pubic symphysis. Now, this is a joint which is unfortunately neglected by most other therapists. It is not checked by most of the therapists, and I say that with all respect, but it is such an important joint because over 90% of my female patients that I've seen over the years have had a pubic symphysis dysfunction, which have been missed by pretty much everybody. When you are in labor, what happens is that this wonderful sort of joint, which gives your pelvic girdle the support that it needs, actually has to go all soft and mushy to allow your pelvic girdle to open up so that the baby can be born. And regrettably, there is no check that is done afterwards to ensure that that pubic symphysis has gone back to its normal alignment and normal position. So it is really important that it gets checked, especially if you're suffering from groin pain, hip pain, or back pain after a pregnancy. And it might be that that pain starts maybe 5 years, 4 years, 10 years, even 15, 20 years afterwards. But one of the indicators is a weak bladder, because the bladder sits right underneath that joint, and sometimes a lot of sort of patients that come in to see me with sort of either groin pain or back pain who are suffering with this will complain of a bladder issue where they are struggling to sort of either they have to rush to the toilet, or when they jump or laugh they get a little bit of leakage. So yes, pubic symphysis is really, really important, and one of the great things about coming to see me as a female is that we will check that, okay? And please understand, it is non-invasive. I will not be sort of doing any kind of sort of invasive examination. It's all done through muscle testing the muscles that are around there, okay? It's not done in any other sort of more invasive way than that, okay? And I can absolutely assure you, and you are fully dressed throughout the examination, okay? Now, the other thing that we're going to check is obviously your SI joints as well, because when the pelvic girdle is loose, then obviously the hip joint, then the pelvic girdle is going to be moving not as it should do. And one of the things that sort of having an unstable pubic symphysis is that the hip joint can also be affected, so you could be having a hip joint problem as well. The great thing about coming to see me is that we're going to check all of that. We're going to check you from your feet, your knees, your hip joint, your pelvic girdle, your lumbar spine, your thoracics, and your neck, because your whole body is connected, and it is so important to get it checked. So we'll be looking at all of that for you, okay? And we will get down to the underlying cause of this pain. And this pain might be something that is you're feeling here in your pelvic girdle. It might be a pain that you're feeling here in your hip joint, in your groin area here. It might even be a problem that you're feeling here, experiencing there, or it might even be radiating a little bit down your buttocks and down into your thigh as well. But we will get to the bottom of it. So I will be examining all of that with you to help you understand, okay? Now, treatment-wise, what we're going to do then is I'm going to treat you doing chiropractic adjustments. And please understand, I'm not one of those chiropractors who does those hard, forceful adjustments that you've possibly seen on YouTube, okay, because I don't like that, having that done on me. I will be using a gentle technique called activator. I'll also be using drops on my wonderful tables in the clinic, and they will be fairly gentle for you, okay? I'm not going to say they're exceptionally gentle, because they're not, and I don't want you to understand that. But if you really want to get to the bottom of why you've got this pain, then please Give me the opportunity to help you understand, but also more importantly to help you. We'll be looking at sort of other things as well, looking at your posture, looking at sort of the ergonomic advice of how you're sitting and how you're walking, how you're sleeping, all of that. I'll also be giving you sort of a whole range of exercises as well, because exercises are important for you to be able to help yourself, because it's about you helping yourself as well. So if you really want to get to the bottom of any kind of pelvic problems, any kind of SI joint problems, then look no further. Dr. Sandhu here from Bedford Chiropractic Clinic, here to help you. God bless you. Give us a call today. We'll get you in today. If not, then as soon as we possibly can. And let me help you. Don't struggle. Don't suffer any longer.